these are high quality, facilities. These are really high quality facilities, but it's a polyclinic, it's not a large hospital, but it's of the highest quality. So we're making sure there's some infrastructure development that's also supporting the health sector response beyond just the normal budget. And we've borrowed from the private sector to do this. And again, we use some innovative ways to raise the fund. So basically what we did was we borrowed money from South African banks, not Zimbabwe banks, South African banks, but then raised the guarantee for us to enable that transaction to be completed from the Export Credit Guarantee Agency under the South African government. And we thank the South African government for that support, that they allowed Zimbabwe to borrow from South African banks using South African government as leverage. So we did that, and then the contract is from the UK being NMS. So it's quite a complex but clever and innovative arrangement which has allowed us to deliver critical infrastructure in the health sector as well. So I thought I'd share this with you. And what I can say is that the government committed to supporting the HIV response program, work with our partners who also support them in doing so, but to supporting the health sector in general. Let me stop here for now. Thank you.
Fantastic. I don't think the minister is as popular in social media, but once he begins to articulate where the money is going, I think we see that there is a need. And that innovativeness is, or the innovation becomes imperative, because you've got to be creative in this very difficult global economy, and also when Zimbabwe is still facing a battery of issues in terms of being able to raise money for infrastructure and do things. But let's move over to Madame French, who is the acting ambassador. We know certainly of the complementary efforts in terms of the international community when it comes to HIV in particular, and so we'll allow you some time to actually give us your prognosis of what's going on. Thank you.
Great, well thank you. I don't know if I'm going to be as loud as the Honorable Minister here, but I will try to project my voice until the mics come back on. Good morning, everybody. It's a pleasure to be here with you all today and be with this esteemed group of panelists. I also want to thank UNICEF for putting together this very important panel, because it is a key issue with regards to kind of not just the United States, but all donor assistance to HIV/AIDS assistance. There's three key takeaways I'd like you to kind of take from this presentation. One, the U.S. government through PEPFAR has been committed to Zimbabwe for the last 20 years and remains committed. And in those last 20 years, we've been able to provide $1.7 billion to supporting Zimbabwe's HIV/AIDS response. And that assistance will continue this year and next year. Two, PEPFAR support has benefited 1.2 million Zimbabweans who are now on life-saving HIV treatment and has helped to control the epidemic writ large in the country over the last 20 years. But I think three, given the purpose of the topic of this panel, we now need to focus on sustaining these gains and ensuring we don't actually backslide from the progress we've made over the last 20 years. Sustainability of the HIV response will only work if we all work together. Not just on this panel, but everybody in this room. And it's going to take strong leadership and coordination by the government of Zimbabwe, with active participation from donors, multilateral partners, civil society, and private business as well. Turning maybe more in depth to kind of the sustainability issue. Sustainable HIV response in Zimbabwe requires leadership, accountability, and donor coordination, in particular on the part of the government of Zimbabwe. And we look to the government, especially the ministers on this stage, to lead that collaboration and coordination among the development partners, the private sector, and civil society. And I really want to applaud Minister Mamshura in his short time in office. He was appointed only a few months ago, and we already talked about how much work he's already been doing. He's taken really positive steps to collaborating and coordinating amongst the donors and encouraging a regular dialogue about our response and about that sustainability issue. But I think as already components of the HIV program, including commodities and human resources for health, or HRH as it's often referred to here. We know there are major challenges in retention of healthcare workers and a high migration to other countries outside of Zimbabwe, and that poses a severe risk to the stability of the Zimbabwe's health system. But to address some of these challenges, the U.S. government, through PEPFAR, has been working on a country-led sustainability roadmap. We actually are funding UNICEF to really take the lead, working with the National AIDS Council to kind of come up and build consensus amongst those key stakeholders on how to ensure that we have a sustainable plan going forward. Part of the roadmap's vision is for communities, civil society, and the private sector to be partners with the government of Zimbabwe. And moving forward, it's going to be very important for health financing data to be publicly available and transparency around the use of domestic resources, like the AIDS levy and the airtime tax, which the minister has just raised, in terms of mapping that sustainability and what donor assistance is still needed. Let's see if the mic is on. Give it a second. It is on. Okay, so you can hear me. So, oh, now it's on. Okay, I will project again. So after 20 years and $1.7 billion invested into Zimbabwe's health sector, there are still threats to sustainability, and we really do need to kind of think about that going forward and how we're going to tackle that together as in a collaborative effort. Again, chronic shortage of healthcare workers, infrastructure challenges such as power outages, as we're experiencing in as well as the over-reliance on donor funding for health programming and commodities, as has already been raised. And while we're eager to strengthen collaboration with Zimbabwe, donors need a clear understanding of Zimbabwe's health expenditures moving forward. And I'm very happy to hear all of the work that the Honorable Minister is doing. And I think a lot of that has to be made publicly available too, so that we understand what the government is putting into the health sector. So of particular importance is the government's financial commitment to human resources for health, as we've mentioned, and kind of ensuring that there's an adequately sized health workforce so that they're able to kind of be able to provide the assistance that's needed to clinics and hospitals throughout the country. Dedication to developing the sustainability roadmap is a good first step, and we look forward to the leadership from the government of Zimbabwe on that process. And we stay committed to that. We stay committed to working with the Ministry of Health, as well as civil society partners and multilateral partners in this country. So I'll stop there, pending any questions when we get to the Q&A. Thank you very much.
I think as Zimbabweans, we love committed donors, and when it's coming from the U.S. Representative here, it is encouraging. I think 20 years with 1.7 billion behind that is a true sign of commitment. Ladies and gentlemen, our next speaker is none other than Mthuli Ncube, who is the Global Director of HIV and AIDS from UNICEF. And she being a sector expert, I think the insights from a global perspective into Zimbabwe are always useful. So over to you, please.
Thank you so much. And let me ride on protocol. Already mentioned Honorable Minister of Finance, Honorable Minister of Health, Acting Ambassador, good to see you. Our time is short, and it's such an important topic. We've already started this discussion in the course of the week. I just want to raise a couple of points. First, I've been coming to these AIDS conferences for many, many years, maybe a couple of decades, and I think I can confidently say that the number of times people outside of UNICEF and the children's sector, like my colleague Chip Lyons, the number of times we've heard children and the response investments. What is that number when we talk about children living with HIV/AIDS? Switch the numbers. 69% of children living with HIV/AIDS who know their status are on treatment. 69 versus 96. Globally, 77% of people living with HIV are on treatment. 57% of children living with HIV are on treatment. So we need to have the discussion about sustainability and sustaining those fragile gains. But when we're talking about children, we're not in a place of sustaining. We're not there yet. We need to accelerate, and we need to find and reach those children and get them on treatment and retain them in care. This discussion, I'm so pleased to be here, and I learn every time I'm in one of these panels, and particularly Honorable Minister of Finance, to hear about the very innovative and diverse ways that you're thinking about this. I think for all of us in UNICEF, we're very excited to feel the energy and hear about it. And I think one of the key important steps around sustainability, because we talk about these very big ideas, is really having that roadmap. And so thank you for the partnership and the support. It's so important to have a roadmap that really very specifically outlines what we need. It's not that today we have investment from global donors, tomorrow it's going to disappear. We need to understand what that transition is, and we need to see it over time in the short, medium, and long term. And here again, Honorable Minister, I think Zimbabwe will provide the leadership that we need for other countries to really get into the details. What do we need in a roadmap? We need to understand the epidemiology and what the gaps are. We need to understand what the quality of services are and how they might suffer if we lose investments into the sector. We need stable financing. We need a productive and salaried health workforce at both facility and community level. And we need the strategic financing that is varied and broad. At UNICEF, I think HIV, again, is kind of that leader that is forcing us to have these discussions and these conversations. What we want to see, and where we think more leadership, we can really provide the leadership, is going from financial sustainability to systems improvement. We want to see that improvement for cancer, for NCDs, for their comorbidities. We want to invest in a health system that is responding to all Zimbabweans, all children and adolescents in Zimbabwe. And so I hope that our partnership and our engagement are bringing people together. It's so important. We've heard about the importance around alignment. We've heard dialogue, complementarity, investment. I think for us at UNICEF, we also want to help build the trust and the consensus, so we have a common understanding of what's involved and what we need to do, and then have our milestones along the roadmap. My plea today is let's not make children an afterthought when we have these big discussions around investment and sustainability. For me, I talk about children living with HIV/AIDS. My colleague Tajuddin here, we're talking about the welfare and the health of all children in Zimbabwe. The situation for children is often an incredible indicator about the health and well-being of our systems and people overall. So I hope we can continue that investment with that broader lens.
Okay, we're back on a so clearly powered minister. And on that note, I think I'll hand over for a quick Q&A directed primarily at the minister to begin with. Our UNDP representative, Dr. Adesole, will take us through the question and answer session. Over to you, sir.
Yeah, thank you very much. Before the Honorable Minister of Finance leaves, he has an appointment that is very urgent. Can I just say from the audience, do we have any pertinent questions that we want to ask the Honorable Minister? How many hands? Oh, it has only 2 minutes. So please, just go straight to the question. Yeah, can I start based on proximity? Here, one in the back, and one in the middle. Yes, it has a flight to catch. So, just probably one. Yes, yes.
Ok, merci pour l'opportunité que vous me donnez. Honorable ministre des Finances, je suis Dr Ketia Dialis, chef service de lutte contre le VIH au ministère de la Santé publique. My name is Dr Ketia Dialis. I'm the chief of fighting against HIV in the Ministry of Public Health. So, one question. In Abuja research, we show use 50% of our country budget for the health system. Just want to know whether this recommendation is effective in Zimbabwe. And the second question, I just want to know if there is
Excuse me, only one.
health system coverage in Zimbabwe.
We will ask the question to others. You want to respond to this first? Okay, let me give you the mic.
First of all, let me apologize, moderator and colleagues. I have to catch a flight to actually leave in exactly 60 seconds.
It's a very good question. Does the Abuja target matter or not? It does.
It does. When we budget, we take it into account.
I did say that when I was presenting that before 2020, we're struggling to meet the Abuja target. We're averaging 7% of our budget being targeted in the health sector. We've since improved. For the 2024 budget, we're at 14.3%. So we're there. We're there. And we watch it every year. We take that seriously. And we continue to innovate, as I explained, with different funds, whether we're supporting the HIV response with the 3% levy, or whether it's a health bond issue that I talked about. As I said, watch the space. Next year, we're going to launch a health bond, because we know there's no limit to innovation. Whether we're looking at the health and the infrastructure as well, we'll continue to innovate, but that 15% target, we always have our eyes on it. Thank you.